afternoon. Today I'm going to be sharing with you guys about the South Carolina Bill 345, which passed earlier this year and focuses on redefining advanced practice registered nurse scope and standards. Bill 345 broadens the scope of APRNs, except certified registered nurse anesthetists, reduces the required oversight by physicians, and also expands prescribing power. So it mainly applies to nurse practitioners, certified nurse specialists, and certified nurse midwives. The bill was introduced February 2017 and was signed by the governor May 2018 and went into effect earlier this year, July 1st, 2018. So why now? South Carolina was heavily motivated by the extreme shortage and in many areas absence of primary care providers, especially in the rural areas of South Carolina. Also, the state is serving as a pioneer for the South to catch up with some of the other states which have already expanded APRN scope. So here's an image that kind of emphasizes how severe the physician shortage is in some areas of South Carolina. In 2014, 13 of the 46 counties had no OBGYN. So just to look at the practical implications, that would mean less access to prenatal care, as well as reduced women's health care in general in these counties. And we already know that prenatal care is really necessary for better birth outcomes, which is something that South Carolina has been working on. Also, if a nurse practitioner wanted to fill the void in some of these areas, and these areas are rural, it might be challenging to find a physician within 45 miles to supervise them. So this is just an example to keep in mind as far as how nurses with a broader scope could help absorb some of this disparity. So this bill created changes mainly in prescribing power and oversight. As far as prescribing, nurse practitioners can now prescribe Schedule II medications within limits. Opioids can be prescribed up to 5 days, and non-narcotic Schedule II drugs such as stimulants can be prescribed for up to 30 days. A doctor needs to have input in order to extend these prescriptions, but it is a broader scope than they had before. As far as oversight, they no longer need to be within 45 miles of their supervising physician, although they still need to have a physician that is available for consultation if needed. Doctors can now oversee 6 APRNs instead of 3, and doctors and APRNs are now required to have a written contract that specifies the scope for the APRN within their specific agreement. A few other changes that this bill made was giving physician assistants the ability to practice telemedicine. It added disciplinary actions if people are not compliant with using that practice agreement between the APRN and doctor. And also the Board of Medical Examiners can conduct random audits to make sure these agreements are in place and being used appropriately. Now we are in the implementation phase, so it is a little early to have solid evidence on the improvements that this bill has made, but the hope is that more people will have primary care providers, money will be saved, and ultimately there will be improved health outcomes for the people of South Carolina. involvement. So in February of 2017, the bill was referred to the Medical Affairs Committee, and March of 2018, that committee voted in favor of the bill. March 14th of 2018, Medical Affairs Committee member Senator Davis proposed an amendment, and that amendment was ultimately adopted. In March of 2018, the bill was referred to Medical, Military, Public, and Municipal Affairs Committee, and in April of 2018, that committee voted in favor of the bill as well. Here's a closer look at the amendment that Senator Davis proposed. It makes some changes, deletions, and additions in wording, and also changes some definitions. The specific example here looks at agreed to jointly, and as you can see, it represents an overall change in mentality from APRNs doing delegated tasks to APRNs doing tasks that have been agreed upon between them and the doctor, more so as a partnership. What committees had issues? So none of the Senate or House committees had issues. The Medical Affairs Committee made some revisions, but overall the Senate and the House worked together to get the bill passed, and Senator Tom Davis was actually one of the sponsors that helped propose the bill. Together they were successful. The bill was ratified May 14th, 2018, was signed by the governor, and then put into effect July 1st, 2018. While the Senate and House did not have too many problems, there was a lot of resistance from larger outside organizations. For example, the South Carolina Medical Association, the South Carolina Hospital Association, and the American Medical Association. All of these groups had a similar argument that the education that APRNs received was not sufficient for them to practice on a higher level without the same amount of physician supervision. There's clearly a conflict of interest here, as there is a financial benefit to doctors when APRNs require their oversight to practice. South Carolina Medical Association. Dr. Marshall Meters, who was past president of this association, cited patient safety as his main concern, and he believed that APRN curriculums were not sufficient for this level of care without jeopardizing patient safety, and he urged his members of the organization to contact their state legislators to voice their opposition and make sure this bill was not passed. The South Carolina Hospital Association agreed with some parts and disagreed with others. They maintained that APRNs were inadequately educated to practice without supervision, but they were okay with physicians being able to supervise a larger number of APRNs. The American Medical Association. So in 2016, the Veterans Administration proposed a similar bill that would have expanded the scope of APRNs, and at that time, the AMA clearly voiced their disappointment with that bill and stated that it was actually going back in time and rewinding the clock as far as patient safety and healthcare goes. The South Carolina Medical Association agreed with the AMA and stated that they hoped this bill did not pass, which would be endangering patient safety. With all this resistance, I'm now going to talk about why this bill is positive for South Carolina. It will provide increased access to care. With the continued decline in the number of primary care providers, nurse practitioners will continue to have a more crucial role in the healthcare system. Nurse practitioners have been identified as high-quality providers, providing cost-efficient care that can expand the amount of people that have access to healthcare. With an increasingly aging population, more health conditions, especially chronic health conditions, the need for access to high-quality care that is affordable for the government and the people individually, as well as preventative care, is increasingly important. This bill will provide reduced healthcare costs. The cost of seeing a nurse practitioner is about 20% less than the cost of seeing a physician. Nurse practitioners can provide equal quality care at a lower cost while achieving high patient satisfaction. They've also been shown to provide more disease prevention counseling, health education, and health promotion activities to their patients than physicians. People who continually saw a nurse practitioner for primary care experience fewer preventable emergency department visits and fewer hospital admissions, which overall is going to save everyone money. Lastly, it's going to improve chronic disease management. Nurse practitioners historically have had strong patient relationships and excellent outcomes with chronic disease management. Improving the population health and access to care is a big driver for this bill, and those with chronic diseases make up a large part of the population that could really benefit from more primary care providers. Also, public health is going to improve as more people have more access. So now we're looking at the summary of the bill. I've included this image to bring the example used earlier back around full circle. With this bill, possibly women's health nurse practitioners could get into some of those counties that lack OBGYNs, help improve prenatal care, reduce pregnancy complications, and by serving the women and their neonates ultimately have a big effect on public health in general. So overall, this bill is going to increase access, save money, improve chronic disease management, and at this point, we are just waiting to see the positive impact that is to come.